Hello. So if you have a little kiddo, there is no doubt that you realize that we are now getting into the height of this early viral respiratory illness season with lots of colds, fevers, and even GI illnesses going around. And as it turns out, our family is not immune to that, as we have had multiple illnesses in just the last couple of weeks for both of our kiddos as we're in between the holidays here. So as Sarah and I have gone through our now third pregnancy journey, sharing that with you and sharing parenting tips and some medical information and some of our in real life experiences, we thought this would be a great opportunity for us to sit down and say, hey, what should you do when your toddler is sick, when they have a fever? And so we're going to dive in that tonight. For those of you who may be meeting us for the first time, I'm Kurt. I'm a board certified pediatrician. Sarah's a board certified OBGYN, and we are the Doctors Bjorkman. So if you're watching this episode, I think there's a good chance you're watching it because you've got a kiddo who's sick at home and you're just wondering, gosh, why is my kid sick again and what can I do about it to help them get healthy faster? That whole question of, gosh, like why are they always sick? Sometimes just our kids are just germ magnets. They touch everything, they lick everything, they put things in their mouth. As it turns out, the average child between 0 and 2 has about 10 viral illnesses a year. Some studies say even somewhere between 12 and 18 viral illnesses a year in that kind of peak toddler age of around a year and a half. So if that's you, it's not your fault. Kids get sick. As we go through this information today, the one thing I do want to say is just no one knows your child better than you. So if at any point in time you've got a concern for your child, talk to their doctor. Like, don't say, oh, like I heard this, maybe they're just fine. If there's something in your gut that says, you know what, I'm really concerned about my kid, something isn't right, call up your doctor, take them to the emergency department if needed. Like, that gut, their parental instinct is there for a reason, so use it. So when we think about this viral season and all of the germs going around, the things that you're maybe wondering about as parent is, hey, what do I need to be worried about? What am I watching out for? And some big questions and things that as I wrap my mind around this, I think about fevers, I think about hydration, and I think about easy breathing. So let's dive into those. So the first thing I want to talk about is fever. What is a fever? The fever is actually your body's natural response to the immune response trying to fight whatever infection is going on, whether it's viral or bacterial. And in many ways, that fever is actually helpful, right? The body can help kill certain bacteria and viruses by just raising its temperature. Even this is part of the reason why there's more viral illnesses during the winter months. People are inside, they're sharing close quarters, but also our body's ability to fight certain infections is hampered by the cold, and that some viruses are able to replicate more at slightly lower temperatures. And so like maybe our noses are a little bit colder in the cold weather, and that makes it a little easier for that common rhinovirus to replicate and spread both in us and spread to other people. So that fever is actually a natural, healthy response. And so what is a fever? Well, a fever is any core body temperature greater than 38 degrees Celsius or 100.4 degrees Fahrenheit. Okay? And so those low-grade fevers of just above 100 to 102 degrees Fahrenheit often are like healthy and not something that you really need to treat unless your kid is really miserable with it. As you know, when you're sick, when you've got a fever, you just feel out of it. You're tired, you don't maybe want to eat as much, you don't want to drink as much, and maybe like your little kid, you just want more snuggles. So kind of the thoughts about treating a fever is really like, if it's getting in the way of other things. If your kid seems miserable, if they're having trouble staying hydrated, which we're going to talk a little bit more later, that might be a reasonable time to treat. Definitely if that temperature is above 102 or higher, it's a good thing to think about treating. As we talk about fevers, I do need to say, if you have a young infant, we're talking the first 1, 2, or even 3 months of life, it's important to let your pediatrician know that your child has a fever. Infants in the first 1 to 2 months of life are susceptible to serious and invasive bacterial infections, unlike older children are, and so those fevers in that early age, those first couple weeks of life, really need to be investigated in person, so reach out to your medical provider. When it comes to treating a fever, you may wonder, hey, what should we use? And the standard and favorite of most pediatricians is going to be Tylenol or acetaminophen, paracetamol. This is a classic antipyretic fever medication that helps a little bit with pain, but really helps bring down that temperature. It can be given every 4 to 6 hours, but in general, every 6 hours is a good place to start. There's good weight-based dosing and age-based dosing on the bottle, but check with your pediatrician for updated dosings based on their most recent well-child visit weight. Once your child is over 6 months of age, it's also really nice to be able to use things like ibuprofen, Motrin, etc. We don't like to use those medications in young infants, so I wouldn't give it to my own child in the first couple months of life because it can be potentially harmful to those young and developing kidneys. Having said that, for your older children, your toddler age kiddo, ibuprofen, Motrin can be even more helpful in bringing down that fever. It's a little better with pain control, and it lasts longer than the Tylenol. So for us, with our almost 2-year-old, ibuprofen, Motrin is our first go-to, and then we're able to use Tylenol for breakthrough fevers or alternating, or if one dose of ibuprofen isn't enough to bring it down and there's still a fever, sometimes we'll add on extra Tylenol as well to really just help get that fever under control, to help with symptoms, help our child feel better, help fight some of those issues that can lead to more and more dehydration. As we're thinking about fevers and being sick, you're wondering, gosh, like how do I just help my kid feel better? How do I help them get healthier better? And this is where hydration comes in. Pushing fluids and some kind of bland nutrition is good, but most importantly, keeping your child hydrated. Okay, this is both one of the biggest risks to your child when sick, and one of the things that just adds on to them feeling miserable. So thinking about frequent fluids, often even small amounts, and then when the question comes to what is the right kind of fluid, really for your toddler, whatever they will drink. Definitely if you've got a young infant in the first 6 months to year of life, there's nothing better than breast milk, formula. But for that toddler age kid, really whatever they're going to drink. So if it's water, if it's watered down juice, Pedialyte milk, all of these are really good at just helping get fluids in. And actually some of these fluids with extra electrolytes, maybe a little bit of protein, a little bit of sugar, can actually help rehydrate better. And it's sort of like, whole milk is actually a great rehydrator. And so if that's what your kid wants to drink, that's okay. If this is the time you're going to let them drink extra juice one day, this is a good reason to say, hey, here's some juice, maybe add a little extra water into it so it's not so much sugar. These are good things to where whatever your toddler wants to drink, let them drink because staying hydrated is so important. With this conversation about hydration, it's also really important to think about, gosh, like how do I know if my kid is dehydrated or not? And one of the good ways to say is like, are they peeing, right? If they're dehydrated, they're not going to pee as often, which is actually something that we noticed and was what tipped us off that our almost 2-year-old was sick, is that like, hey, he hasn't peed in a long time, we're recently potty trained, and so trying to think of, we're still watching like hawks to make sure that he's peeing in the potty and not somewhere randomly in the house. And so we noticed, hey, it's been a few hours since he's peed, what's going on? Sure enough, he had a fever. If your child, toddler age, is going more than 10 to 12 hours between peeing, this is definitely one of those red flag signs that says, hey, you're probably behind on fluid status and maybe getting into that point of having some significant dehydration. For young infants, I say if you're going more than 8 to 10 hours between wet diapers, definitely is a reason to reach out and call your pediatrician. In addition to hydration, another important part that we have to mention with this episode is about easy breathing. So many of these viral illnesses can cause trouble breathing. Either it's just physical obstruction in small noses, small airways that cause stuffiness, like in things like bronchiolitis can really lead to a lot of issues with young infants, or congested airways that just make it difficult to breathe in. But there can also be some inflammation of the airway itself that makes it difficult to breathe. These can be things like noisy breathing in the upper airway and stridor, and things like croup, or maybe there's inflammation in the lung itself with reactive airway disease, things like baby asthma almost, that makes it difficult for them to get air out. So if your child is working to breathe, could be nasal flaring, the skin is pulling in at the top of the throat here, in between the ribs, under the ribs, and you see they're really working to breathe hard or breathing fast. This is maintained breathing more than 60 breaths a minute for more than a half hour to an hour, especially in absence of fever. These can be signs that your child's really working to breathe that you might want to reach out and talk to their doctor about, and I wouldn't delay on that. Now, definitely we know when your child has a fever. This happened for us most certainly because that fever was spiking all of these inflammatory responses going on, and it causes that breathing to be heavier and be faster. But as we brought the fever down with ibuprofen, that fast breathing went away, and that was reassuring. If it had maintained, then I'd have to think more about, gosh, is there something else causing him to breathe heavy and hard? Is there something else I need to be worried about? So then this comes to the, like, what are the things that I get worried about that I'm looking for when my child is sick? What are the things that I really want to be able to look out for that would make me want to seek more medical attention or call a pediatrician, bring them to the ED? And so this is one of those things like, hey, what are other things that could be causing fever other than just a standard virus? When is it more than just a fever? So this could be things like ear pain. If your child's pulling at the ear, might be a reason to look in the ear. So now, of course, it was day 3 of fever for Bo this last weekend. He was pulling at his ear, and Sarah's like, oh, you got to look in his ears. Maybe he's got an ear infection. And so the benefit of having a pediatrician at home is I just got to look, say, oh, it's not an ear infection. Other things that would be reasons would be prolonged fevers. So if they're having fevers for 4 going on 5 days, we'll have to start thinking about, hey, maybe this is more than just a viral illness. Now, the average viral illness does take a few days to peak and can peak around day 5 of illness, but if they're having fevers every day for 5+ days, we have to think about other bacterial infections that maybe the body's having trouble fighting. Is it a pneumonia? Is it a sinusitis? Is it a urinary tract infection? Also, something that we pediatricians think about is something called Kawasaki's disease. So if they've got daily fevers for 5 days and they've got red eyes, they've got a red tongue, cracked lips, rash, peeling fingers around the fingernails, swollen lymph nodes in their neck, these can be signs of kind of a bigger inflammatory syndrome going on within the body that does need acute medical assistance and treatment to help prevent some other long-term complications. So again, day 5 of fever every day in a row is something that makes me say, hey, we need to look a little bit deeper.
Poor Bowie.
Yeah, poor
Man,
guy.
he has been a little sicko for the last all weekend. And
How high? What's the highest you've seen on his thermometer?
I
for
mean,
him?
that temporal thermometer is not perfectly accurate. It said like 106.1 at some point.
Yeah, which I can't imagine was true.
No, and then you swipe again and it says like 102.5. So, but he was toasty, babe.
He's been hot.
He's been, yeah.
Something that I don't think we talked about in our episode was like, does the height of fever matter a lot? And it really doesn't. Like, there used to be thoughts that the higher the fever, the more likely it was bacterial, but that really hasn't been played out. So
Yeah.
just like the higher the fever, the more quickly they get dehydrated.
Gotcha.
Maybe there's some association with really high fevers and febrile seizures, but
Okay. But if it was just 99.7, Dad said that doesn't count as a fever.
We're not
treating it.
Yeah.
So, but I mean, he would have a fever, easily 102, 103, and you could just tell. He was clingy, he was warm, he was just wanting to lay on somebody and not feeling like himself.
Did not feel well.
Yeah, that was enough to say, all right, buddy, you're going to get some orange or purple, the Tylenol or ibuprofen, and you could tell once that fever kind of broke and his meds would kick in, he'd get his little energy back and
Just
he'd
be
go
happy.
play for a little bit. And
then a couple hours later, you'd be like, wow, he's getting kind of fussy, and you'd touch him and he'd be hot.
Yeah,
right?
yeah.
And
So-
yeah, we've got like, we're not brand loyal to anyone who treats fever, but, Tylenol, acetaminophen, children's Motrin. Talk to your pediatrician about dosing. There's dosing on the bottles that is pretty good for their weight or their age. Those are really nice good guidelines. You may find that like oftentimes at your well visit, I know many of the pediatricians I've worked with over the years, they like give you an updated like, oh, here's your dose for their weight today.
Yep,
is
based on
really
weight.
nice because sometimes you can actually give a little bit more than what's on the bottle, but you don't want to do that just on your own. So,
right. Yeah, yeah.
one thing that we can probably talk about, like, how do we give medications to? Like, these cups are great if your child is going to school. But like, I tried to give Bo medication with this a couple times this weekend.
He did okay.
He did okay, but
Yeah,
like,
well, you can show it.
but like, it's so much easier. We like, to have a little syringe that you can say, oh, he needs 5 ml. So you can just put it in the thing and draw up, or you pour it in a little cup and draw it up to give it, because then you just put this in the mouth and you squirt it in slowly.
Yep.
Then it's just in. You don't have to worry about them coordinating their swallow.
Or spilling it all
Yes,
over.
all over.
It's so sticky.
When our kiddos were really little and we were just giving Tylenol in those first 6 months, having a little pacifier, I forget who makes this, Frida Baby, I think this who makes, the syringe just goes into this and then it, it sprays in through, it comes out the tip of the pacifier. It was really slick for young infants.
Yeah.
Yeah.
Other pro tips, I mean, he had a whole variety of like little water bottles full of water, milk, juice, whatever all weekend, because it was just the thing that kind of tipped us off to this was for whatever day, we were like, oh, it's been like 6 hours and he hasn't peed. He hasn't had an accident. He didn't pee in his car seat. He didn't pee on anything.
Because he's diaper free, and so we're like, we had a couple weeks ago we had a bunch of accidents in 1 week. We're like, oh, we need to like pretend we're just starting potty training again.
Yes.
And so like, he hasn't peed. Is he okay?
And then touched him and he was warm, and we said, he needs to drink a lot more. He's got a little fever. Here we go.
Yeah. We touched a little bit about alternating the fever meds too, which you can absolutely do. Children's Motrin is every 6 hours. Technically, Tylenol can be given every 4, but it's really nice if you just keep them all on an every 6 hour schedule.
Right.
And then, like, if the fevers are breaking through, you could give one every 3 hours. So, like, 3 o'clock you give Motrin, 6 o'clock you give Tylenol, 9 o'clock you give Motrin again. So they're each spaced out individually 6 hours is nice.
And there are some like dye-free Tylenols, Motrins, whatever's.
Yeah.
We've tried it. Our kids didn't like it, so they get it so infrequently.
They really like the sugary flavors.
What are you going to take without spitting it out? So he's just been a sweet little sicko, and it's sad, but the cuddles have been fun. And
tomorrow's going to be day 5 of fever. Some of that is like, gosh, what are other causes for fever? So,
you did look in his ears
today. He pulled on his ears one time, so I was like, oh, is it an ear infection? So, like, the benefit of having a pediatrician at home is I can just look.
It's not his ears. It's just
not his ears. But some of those other things, like if he had some other signs, like definitely just touch in with your pediatrician if it's going on day 5.
Yeah. And otherwise, hang in there.
Yeah.
He's just a little grumpy bear.
Yeah. And having a good way to check their temperature at home is nice. Like we don't have anything, but like the temporal thermometer is easy. It's not perfect. If you've got one that goes in the mouth, or goes in the ear, goes into the armpit, those are all a little bit more accurate. Rectal thermometers are the most accurate core temperature, but really not necessary in the terms of just like helping your kid be well at home.
Can you imagine?
Yeah, Bo would not tolerate.
Neither of them. Anyway, also stay healthy because your virus is coming soon. But hang in there. Their little bodies are amazing. They're building their immune system with every different virus they get. They're getting stronger. They're learning many things at school and daycare. And some of that is their immune system getting stronger too. And yours. So hang in there.
We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.